Now, next up, I wanted to introduce Kieran Reynolds. He's an advanced specialist pharmacist for medicines governance at the Specialist Pharmacy Service. And he and his team have developed a Varenicline PGD. And so over to you, Kieran.
Afternoon, everyone. Can everyone see my slides?
Yep, they're up.
Perfect.
Thank you.
So thanks again for the invite to speak to you all today. As Sanjay has said, my name is Kieran Reynolds. I'm a pharmacist, excuse me, within the medicines governance team within NHS Specialist Pharmacy Service. And I'm going to give you a quick run through of the smoking cessation patient group directions, or PGD templates, that we have developed and are currently in development. So your first question is probably, well, who are SPS? Well, we're a service that is commissioned by NHS England. We span all 7 NHS England regions, and our objective primarily is to work together to do once and share. And we provide advice and guidance to all NHS or NHS commission services on buying, making, and using medicines. Our role within the development of national PGD templates came across as a result of the Lord Carter of Cole's review into inefficiencies in the NHS, which recommended the standardisation of the development of PGDs and other medicines policies and other organisational governance documents. And the aim of this is to help to reduce duplication and help release local resource that can be redeployed elsewhere. And we are responsible for the development and maintenance of a range of PGD templates that are used nationally. The most commonly used ones that we have are in reproductive and sexual health services, also in ambulance service, radiology, and now smoking cessation. So what is a PGD? Well, it's a written instruction which allows the supply and/or administration of a medicine in the absence of a patient-specific direction or a PSD, a prescription, or a legal exemption as laid out within the law. And they can only be used by registered healthcare professionals listed within the legislation. So non-registered staff cannot work under a PGD. And PGDs are not prescriptions, and I'll give you an analogy in a little bit. And as Matt has pointed out, there may be some resistance in using PGDs, and this is due to NICE's standpoint, which is that PGD should only be used where there is no other suitable legal mechanism for the supply and administration of medicines. Now, when a PGD user works under a PGD, they do so autonomously. So they're responsible for assessing that the individual meets the criteria set out in the PGD, as there are no deviations allowed. So clinical judgment cannot be used to supply or administer medicine outside the criteria specified within the PGD. Registered healthcare professionals must only work under a PGD when they're listed in the legislation, so their professional group is listed in the legislation as being allowed to work under PGD. They are fully trained and competent to work under the PGD, and they have been individually assessed and authorised to work under that PGD. And no delegation of responsibility is allowed. So all activity that includes the consent, clinical assessment, the supply and administration, and record keeping have to be undertaken by the same individual. So the analogy that we often use is prescribing is an all-you-can-eat buffet. You can tailor the plate to the needs of the patient, but a PGD is a set menu. You're either in, you're out, no changes, and no substitutions allowed. So we have developed 2 PGD templates. The first is Varenicline, which was published in October 2024, and then cytisine or cytisine will be published once the NICE guidance is published endorsing its use, and that guidance is expected to be published in February 25. So these PGD templates have been developed with the support of NHSE and other specialist stakeholders working within clinical practice, including doctors, nurses, and pharmacists. And PGDs are an option for smoking cessation services to use. We hope that these and other PGDs help facilitate assessment and treatment initiation on the same day, shorter and simpler treatment pathways, and enable non-prescriber-led services to prescribe prescription-only medicines. So none of this work could be done without the help of the Short Life Working Group, whose advice, comment, and clinical review is paramount to the success of this, and this is the Short Life Working Group for our Varenicline PGD. Now, for many services, getting PGDs into operation is a brand new step that they have to undertake. Now, I'm going to give you a summary of the steps that are required to get it into operation, but we've also developed a 2-page document specifically for smoking cessation services that we will share after the webinar that will help you kind of digest it at your own pace. So the first step is that the PGDs have to be clinically reviewed and then signed by a senior doctor, a senior pharmacist, and then any other professional group representative who'll be using them. So this is most commonly nurses. The PGDs then have to be authorised by what is defined in legislation as an appropriate authorising body, and that's most likely an NHS trust, a foundation trust, or a local authority. And just to note that where a independent healthcare provider or a charity provides a services which is commissioned by an NHS uh, trust or local authority, the NHS trust or the local authority is the authorising signature. Now, the identity of who will sign on behalf of that body will be dependent on the organisation's governance structure, but this will be a well-trodden path for other services within trusts and local authorities, so somebody will be able to answer that question within your own locality. Then the PGDs should be reviewed through the organisation's PGD governance structure. This is most commonly within an NHS trust, is a Drugs and Therapeutics Committee or a Medicines Management Governance Oversight Group. And again, your local pharmacy team will be able to provide you with more information about who this is. You then need to determine what relevant training needs to be completed so that practitioners can be assessed and deemed as competent to work under these PGDs. And these resources or training resources can be provided either by local or national resources. And I'm sure we'll hear about some of them later on today as well. And then the final step is the supply of medicines. So supply of medicines under a PGD requires medicines to be overlabeled with the dosage instructions and address in the service, as well as space for the individual's name and date of supply to be written on by the PGD user. The only exception for this is a registered pharmacist working within a registered pharmacy premises who can dispense it. Again, liaise with your local pharmacy department or team to determine how you can acquire these overlabel stock. And this is an example of an overlabeled label for a treatment for hepatitis C. So it gives the medication name, the dose and frequency, any special instructions, the address of the dispensing pharmacy, and then space for the patient name and date of supply. So to surmise, so these smoking cessation PGDs, so Varenicline published in October and cytisine coming in February, are an option for services to use. They do require local sign-off before they can be used. And for the majority of services, they will require supply of overlabeled medicines. And we recognise that they will work for some services, but may not work for others, but we hope that the majority of services will be able to use them. If you have any questions, you can always contact us on our email address, which is shown here. And all our resources are available for free of charge on the SPS website. Simply go on the toolbar, guidance, and then PGDs. Does anyone have any questions?
So Kieran, I think the
Whistle stops
questions.
store.
Yeah, that's great. No, thank you very much, Kieran, because I don't think everybody will be familiar with PGDs. And remember, a lot of colleagues on the call are from local government, and I think a lot of the stop smoking practitioners in the community aren't necessarily registered healthcare workers. So I don't know that they would be able to necessarily use it, but there may be others. So I think Matt had mentioned outpatient areas and then using PGDs with maybe some nurses and who are registered, and so there may be a usage there. And I think that I'm guessing a lot of local government services are looking to mechanisms that might be helpful. And community pharmacy, which we've not got a speaker on today's webinar, maybe another option, but we can talk about that in the Q&A. So there was one question that I did spot for you, Kieran, in the chat, and that was, is there an SPS service in Northern Ireland? And does your PGD apply to Northern Ireland, I suppose?
So SPS is commissioned by NHS England, so all the advice and guidance that we give is tailored to legislation and practice within England. All our resources are available free of charge, regardless of your IP address. So if you want to use our PGDs, you are more than welcome to, but you need to be aware that these are designed specifically for use in England. So you need to tailor them for your own kind of local services.
Okay, brilliant, Kieran. Thanks ever so much. Right.